Well, I'm Matt Wagner, a research scientist with the Wyoming Survey and Analysis Center. Our project focuses on crime victimization data on the Wind River Indian Reservation. Located in west central Wyoming, the Wind River Indian Reservation includes both the Eastern Shoshone and the Northern Arapaho tribes. It's the 7th largest reservation in the United States by geographic area and the 5th largest in population. Approximately 27,000 people live on the reservation across 3,500 square miles. The project will be expanding existing relationships in addition to developing new ones. There are 5 partners involved in the project. One of the partners is the Eastern Shoshone Victim Services Program. Stephanie's here. She's going to tell you a little bit about what she does.
Hi guys, I hope you can hear me okay. My name is Stephanie Warner. I'm the Director of Eastern Shoshone Victim Services. We do serve the entire Wind River Indian Reservation. Our grant is just under the Eastern Shoshone tribe. That's why it's called that. We serve those that are victims not only of domestic violence, sexual assault, human trafficking, dating violence, but we also serve those that are victims of any crime. We actually work with the Tribal Prosecutor's Office and the court, the tribal court, through being victim witness advocates, or victim witness coordinators, so that we are able to stay in close contact with victims of crime as the court process is going through, and making sure that they're aware of their rights and that they're involved in the process should there be a plea agreement or with testifying. We also do civil processes, so we do protection orders and attend court even if there isn't a criminal aspect. We'll go with them to their protection order hearings and help get them resources for shelter. We collaborate with Red Paint as well for shelter, and then getting them resources like door locks if they need it, to change out door locks, new phones. We've had a lot of victims that have their phones broken by the perpetrator, and so we help replace that. We have a lot of resources that we're able to help victims with in terms of getting items replaced and helping with victim compensation. And I'm just trying to think to make sure I cover everything. So this is a new program. It just started back in October. The funding started in, I believe, April through the Tribal Set-Aside grant. And we're hoping to be able to continue it because it is definitely needed in our area.
Thank you.
Mm-hmm.
So Wind River Cares is also one of our partners, as is Red Paint Alliance, and Stephanie will tell you a little bit about what they do. Oh, sorry, Emily will. My apologies.
I believe that Vivian is on the phone.
Oh, okay, great. Sorry.
Okay. Vivian, are you here?
Good afternoon. This is Vivian from Wind River Cares. So Wind River Cares has a couple of different programs. Actually, we have 3 different programs that we are operating. One is through OVC, which deals with case management and sexual abuse relating to pediatric patients, and those physicians are housed at our children's home. And then we also have 2 other grants that are specific to domestic violence, dating violence, human trafficking, sexual assault, and stalking. And so we have 3 individuals that are hired under those grants, and we work within the healthcare system. And so our primary focus is connecting victims with SART and SANE teams for the sexual assault exam. We are the only agency within Fremont County that has certified SANE nurses or providers, and we work within the healthcare system, and we assist patients with navigation for healthcare resources as well as limited financial resources. And yeah, it keeps us extremely busy. We also have healing circles. We have partnered with our behavioral health department and recently Minnesota Women's Coalition Alliance. And during COVID, we are offering virtual healing circles, which has been interesting. But so our focus primarily is on healing and behavioral health and the exams for sexual assault.
Thank you. Emily, did you want to say anything about Red Paint Alliance?
Sure. Is Aaron on the phone? I know that there was 2 callers on there that didn't have a name. Okay, I will go ahead and read what they had sent in for Red Paint Alliance. They provide direct services to victims of crime, including domestic violence, sexual assault, dating violence, stalking, sex trafficking, and historical trauma through crisis intervention, prevention, advocacy, recovery, and traditional wisdom. Red Paint Alliance vision is to end violence on the Wind River Indian Reservation and restore the Eastern Shoshone and Northern Arapaho's traditional way of life. Red Paint Alliance values are rooted in the traditional healing practice of using red paint, which reflects the following Eastern Shoshone and Northern Arapaho core values of family, humility, humor, language, tradition, spirituality, life lessons, respect, courage, honor, bravery, generosity, love, wisdom, sharing, honesty, strength, and freedom. The goals of Red Paint Alliance are to provide specialized trauma recovery services by means of referrals to licensed counselors or practitioners when warranted, utilizing the Visioning Bear curriculum for offering talking circles throughout the community, and partnering with other entities to encourage community healing and growth with the support of tribal elders in partaking in ceremonies specific to each victim's ethnicity or religious preference. They raise awareness of rape and domestic violence services across the Wind River Indian Reservation and surrounding community by collaborating with service providers who represent those vulnerable to sexual assault, domestic violence, or family violence, and improve access to services and reduce the impact of sexual assault or family violence. Red Paint Alliance operates in an evidence-based best practice, quality assurance, and quality improvement framework.
Thank you. I'll tell you a little bit about the organization where I work. The Wyoming Survey and Analysis Center is a grant-funded research center at the University of Wyoming. The center seeks to provide a clear and accurate information to improve people's lives through applied social science research. It's also the state's Statistical Analysis Center for Criminal Justice. The 5th partner is the Wyoming Division of Victim Services. They are the state's VOCA administrator. Its mission is to cultivate social change and access to victim services through the provision of resources, education, and program support. They also advocate for legislative, judicial, and social reform that benefits crime victims. About our project, access to relevant crime victimization data for the Eastern Shoshone and the Northern Arapaho tribes on the Wind River Indian Reservation is essential for these organizations to serve crime victims in their community. The victimization data that service providers need is often difficult to access because of challenges related to variation in data collection and reporting. In this project, the Wyoming SAC and victim service providers on the Wind River Indian Reservation will work together to identify available data sources so crime victim service providers can more effectively confront victimization in their community. For example, in addition to giving them leverage when applying for funding opportunities, with data they would be able to identify those that have a higher risk for victimization and provide counseling and treatment services. The project has 4 goals. All 4 focus upon strengthening or expanding the partnership between Wyoming SAC, Wind River Indian Reservation Victim Service Providers, and the Wyoming Division of Victim Services, and ways to improve data-centric resources at their disposal. The first goal is to develop the partnership between WYSAC, the Eastern Shoshone Victim Services Project, Red Paint Alliance, Wind River Cares, and the Division of Victim Services. And second is to identify and define critical data needs as they relate to the provision of victim services on the reservation. The third goal is to identify available data sources for understanding crime victimization. And the fourth is to develop next steps and future goals for the partnership and to access and use crime victimization data. In April, we had an initial meeting to discuss the beginnings of the partnership and the project going forward. In May, the partnership will work to learn how the judicial system impacts victim services on the Wind River Indian Reservation and to assess the availability of crime victimization data. In June, the partnership will identify both existing data sources or known data sources and data needs. And in July, WOCA-SAC will map existing data sources and compile a comprehensive list of both known and then needed data sources. In August, the partnership will identify next steps, and in September, WOCA-SAC will compile the final project report for both the tribes and JRSA. So, is there anything else anyone would like to add or comment on? Well, thank you for your time, and we welcome any questions you might have.
Thank you all so much for that. If anyone has a question, feel free to chime in verbally or put your question in the chat, or you can raise your hand and I'll call on you. One thing that I was thinking of, Vivian, when you were talking about the virtual circle healing was, you know, perhaps some lessons learned there could help the Illinois team as they're, you know, navigating those virtual focus groups.
Well, I suppose some lessons learned is even though it seems like everyone that you encounter has cell phones and seem to be able to navigate through different platforms, when you have a specific task, such as downloading the platform that we're using, you almost need an IT director to help participants navigate through how to register and where the link will be to join the virtual platform. And then I guess the other biggest lesson learned is our participation has been fairly good. However, I think there's some hesitancy to join just because of the fear that other people, it's the confidentiality. And so I've reached out to some folks in substance abuse to see how they're conducting groups, and they're more of closed groups, but there's some open AA meetings. So I'm trying to figure out how we can increase participation. I mean, we've had, our numbers are around 5 to 6 participants. Last night we had some technical difficulties, and so I believe we lost some of the folks. But yeah, it's all learning with the COVID-19, and I know our trauma service specialists have had an increase, a dramatic increase in calls because people are shut in, and that's why we initially we were trying to think outside the box and provide services while people are shut in.
Thank you for that, Vivian. Yeah, that's so many challenges that we're all encountering now. Susan, did you have a question? I saw your hand up and then it went down.
I was just going to ask quickly, Matthew, if you could give a couple of examples of the types of data sources that you'll be examining as part of this project. I know you haven't really delved in yet, but just a kind of taste of what's to come.
I'd say, I mean, really anything that creates kind of the bureaucracy involved with victim services and then, victimization. So whether that relates to, the criminal justice system or something outside of it, it's difficult to say, really. Emily, did you have anything you wanted to add?
Well, as Matt said, we are just getting started in our process and convening this work group of partners, and our process is going to be driven by the needs of the victim service providers on the reservation. So, things that we have talked about before are, how alcohol is related, how crime data that is held within the different court systems in the county versus what's available to the reservation. But we have not developed a comprehensive listing.
I mean, I would say it's conditional largely upon what's needed by service providers in the community. That kind of drives what kind of data we collect, or what data we look for anyway, I should say.
Great, thank you.